Treatment for your hip arthritis is always going to start with a comprehensive subjective review. We're going to give you an intake test that's going to capture your subjective deficits. I'm going to ask you what kind of mobility deficits you've noticed. Where is the pain located? It's typically going to be on the front and side of your hip. You're going to notice morning stiffness, less than 1 hour in duration. You might notice some side-to-side differences. In this case, you'll notice this patient has a restriction of motion on her right leg, which is the hip she's coming in for treatment for. Your history, activity limitations, and goals are going to direct the examination. That's where I'm going to have you move through a different series of tests and measures. In this case, this patient is very interested in her morning walks, so we're going to take a look at her movement quality during walking. And here you'll notice she has a slight lateral lean whenever she's on her right leg. That will lead to impairments in strength and possibly more hip and back pain. So it's important to kind of clean that motion and problem up during our treatment. You'll notice here she's lacking hip flexion on one side compared to the other. This is a common presentation for people with hip arthritis pain. We're going to do a few tests on one leg, including single leg balance, which you'll notice she has decreased balance on her affected right side. And I'm going to ask her to do just a slight single leg squat. And from this little motion, a lot of information is derived. I can see how she accomplishes the motion, and in this case, it's not as well controlled on the right, and she has a little bit of hip pain. This is going to help steer not only the rest of the exam, but the exam into treatments that are unique to her. Since walking is a big priority for her, I'm going to make sure to assess her fall risk and make sure she remains at a low fall risk so she can comfortably walk in the community, not only to go to the grocery store and go to a show, but also because she likes to walk for exercise. Lastly, during the exam, I'll assess the joint mobility, because where a joint moves indicates where it's been. And in her case, we're missing that internal rotation, and there's some posterior capsule tightness, which will be one of the first things we're going to clean up during our treatment sessions. So now that we've had a lengthy discussion, I've performed the full exam, I'll always try to explain and educate the patient on where their pain is specifically coming from. And in her case, it's this tight hip capsule that has led to muscle problems, gait impairments, that lateral lean we saw in the beginning, and it's from there that the exam will lead into her unique treatment plan. The exam will always meet you where you're at your specific level of activity limitation and pain. But it's that individualized exam that will lead into your unique treatment plan. From here, exercises will be geared towards the impairments that were displayed during the exam and can rarely be carried over from patient to patient. Doses and duration may range from 1 to 3 times per week, depending on the limitations, and you can expect to be in a physical therapy plan of care between 6 and 12 weeks, depending on whether you have mild or moderate hip osteoarthritis. For this patient, we only ended up working together 1 time a week for about 6 or 7 weeks before she was back to walking her normal 3-mile route. We started with opening up her hip joint with these manual therapy techniques, and as that hip motion improved, we were able to add exercises like stretching and strengthening to augment and sustain the gains in her range of motion, flexibility, and strength. This patient was discharged with just a few exercises, and to continue monitoring her exercise as it relates to unloading her arthritic joint and also paying attention to any of the gait impairments that we've been working on so that she can stay active for a lifetime.